Okay. So today you will be seeing Lisa Reitz, who's a registered dietitian at the Cleveland Clinic Taussig Cancer Center. She will be talking with us today about some things that are important and near and dear to her heart. So, just for purposes of sharing, Lisa has received her bachelor's degree from the University of Akron and her master's degree from Case Western University. She's a certified nutrition support clinician and an advanced practice dietitian. Lisa has a lot of information to share with us today, so um, we'll get started. But my name is Susan Eckenweiler, and I'm a social worker partnering with Lisa on this presentation. I will be monitoring the chat and going over just a few ground rules, maybe for how the presentation will work today. So we would like to hold comments and questions till the end of the presentation, but if something is on your mind and you want to type it in the chat, that's fine. We'll be circling back to that. You can raise your hand on screen if you want to do that, and we'll let you know when you can unmute to go ahead and ask questions and talk a little bit. So if you have any technical issues, please also put that in the chat. That's what I'm here for, is to monitor the chat. The purpose of stopping the recording when the presentation is over is to help maintain confidentiality. This is a very safe place for people to ask questions and share maybe what they might need to related to dietetic needs. And we want to respect the time that we have set up, which is until 12:30. We would like to ask for people to mute their microphone. And again, to just maintain confidentiality of the presentation, including screenshots and comments that others may make. So I know Lisa has a lot of good information for us, so why don't we go ahead and get started?
Thanks, Susan. So yeah, my presentation will be on eating well after cancer. So the objectives today are to define the basics of a general healthy diet after cancer treatment. We are going to review the American Cancer Society recommendations for physical activity. And we're also going to review common media trends versus evidence-based guidelines for cancer survivorship and nutrition. Now, it is important to note that nutrition goals should be personalized to you. And due to the nature of this presentation, the information provided is only the basics. Should you have additional questions related to your personal nutrition goals, we'll provide you with information about how to contact a dietitian at the end of this presentation. So, first starters, we're going to talk about what to eat more of. And a lot of this is consistent with the Mediterranean diet, if anyone has heard of that before. So, we want to focus on whole, unprocessed foods such as lean meat, seafood, low fat dairy, eggs, all of which are good sources of protein. We want to incorporate a variety of fruits and vegetables, which are an excellent source of antioxidants, phytonutrients, and fiber. We want to include whole grains, beans and legumes, and nuts and seeds. It's also important that we not forget our heart healthy fats, which are found in fish and nuts and seeds, and they are a crucial component of a healthy diet when consumed in moderation. So this goes over a heart healthy plate, and I'm just going to discuss it briefly on how your lunch and dinner plate should typically look like. Obviously, it's not always going to look like this, but when we look down at our plate, we want to see half of our plate as the non-starchy vegetables. So the examples are included here, such as broccoli, asparagus, Brussels sprouts, etc. A fourth of your plate should be your protein. And the reason why I cross out lean pork is we will touch base in another slide about red meat and cancer prevention. The other fourth of your plate should be your complex carbohydrates. So that will be like your sweet potatoes, regular potatoes, pastas, rice, things like that. The fruit is just to show that fruit can fit into a healthy diet and a healthy meal. So, a serving of fruit is a small fresh piece of fruit or a cup of mixed fruit. This also goes over just a dab of healthy fat. So, like the avocados, olive oils, nuts and seeds, those kinds of things. And then making sure that you're drinking plenty of fluid with your meals. Obviously, water is best, but other healthy options include, an 8-ounce glass of 1% or skim milk, or unsweetened almond milk, or soy milk. Again, this kind of um, goes in line with the Mediterranean diet, heart healthy style of eating. Next, we'll talk about what to eat less of. So, one of those being red meat. So, when we think of red meat, think of animals with 4 legs, like cows, pig, lamb, things like that. The American Cancer Society recommends limiting red meat to no more than 12 to 18 ounces per week. And that's because there is strong evidence that consuming too much red meat may increase your risk of developing certain types of cancers. But it is important to keep in mind that red meat does have nutritional benefits too, such as heme iron, which is important for energy and preventing anemia, vitamin B12, which is essential for brain function and nervous system health, zinc, which supports immune function and wound healing, and red meat is also a high quality protein. So, all that to say, you can still have red meat, it's just the amount of red meat that we want to watch. In addition to red meat, we want to eat less of processed meats. So this includes deli meats, bologna, sausage, bacon, pepperoni, hot dogs, those kinds of things, which I will talk about more in the next slide. We also want to eat less of the highly processed foods, such as packaged or convenience products, the refined grain products, so white flours, white breads, cereals, crackers, desserts. We also want to limit our sugar sweetened beverage consumption, and we also want to limit our alcohol consumption. So, overall, diets high in processed foods can contribute to weight gain, being overweight or obese, and we know that greater body weight is a contributing factor to 12 different types of cancers. So, why do processed meats increase your risk for developing certain types of cancers? And there's a few reasons behind this. The nitrates and nitrites that are added to preserve color and prevent spoilage has been shown in lab studies to form carcinogens. Also, the way processed meats are smoked. So, smoked meats contain polycyclic aromatic hydrocarbons, which are considered carcinogenic. Processed meats are cooked at high temperatures, which can also contain those carcinogenic factors and which can damage DNA. And heme iron, which is found in red meat, may damage the lining of the colon if eaten in excess. Next, we're going to touch base on alcohol and cancer risk. So, there is strong evidence that alcohol can cause several different types of cancers or be a contributing factor to different types of cancers, including head and neck, esophageal, liver, breast, and colorectal. And the reasons behind this are it may damage the DNA of cells, alcohol increases oxidative stress in the body. It decreases the absorption of vitamins and minerals that can help fight against cancer. Alcohol can raise the body's level of estrogen, which can increase the risk of breast cancer. And too many alcoholic beverages may contribute to excess calories, which may increase body weight, which puts you at risk for developing certain types of cancers. So, a standard alcoholic drink is equivalent to 12 ounces of beer, 8 to 10 ounces of malt liquor, 5 ounces of wine, or a shot of liquor. And the more alcohol a person consumes on a regular basis, the higher the risk of developing certain types of cancers. The American Institute for Cancer Research recommendations are to eliminate alcohol entirely. So we hear, okay, what to eat more of, what to eat less of, but how do we actually know what we're eating? And a good way to make the right choices when we're out shopping is to look at the food labels on products. So first we want to look at the serving size, which is at the top of the nutrition facts label. And we want to adjust the nutrient as needed based on your portion size. So for example, the serving size on this nutrition facts label is 1 cup, but there's 4 servings per container. So if you eat that entire item, you need to multiply all the numbers listed below by 4 because you're eating the 4 servings. If you ate just 1 cup of this item, these would be the numbers, but if you ate the entire thing, you'd have to multiply all the numbers by 4. So that's what I mean by adjusting it as needed based on the portion size that you consume. Overall, we want to reduce our intake of added sugars, which I will touch base on in a later slide. We want to decrease our intake of saturated and trans fat, and we also want to reduce intake of sodium. So the current recommendation for sodium is to keep your sodium intake at 2,300 milligrams or less per day, unless instructed otherwise. Sometimes we have patients who have heart conditions or blood pressure or fluid status concerns where we need to limit sodium even further, but that's the general recommendation. We also want to increase our intake overall of fiber, which fiber would be listed under the total carbohydrates category on the food label. And the goal for fiber is 25 to 35 grams per day. We also want to increase our intake of those unsaturated or healthy fats. This category of the percentage of daily value, don't bother looking at it or using because that's based on a 2,000 calorie a day diet, which is not accurate for every person. Next, we're going to touch on physical activity. So staying active is another important aspect of overall health. The American Cancer Society recommends 150 to 300 minutes of moderate intensity activity or 150 minutes of vigorous intensity activity each week. Benefits of staying active include improved energy levels, improved mental health and outlook, which will lessen depression and anxiety, improved sleeping habits, improved muscle strength and bone health. It can help increase your appetite if you're having issues with a reduced appetite, and it can also help you to achieve a more optimal weight. If you're currently sedentary or not doing much physical activity at this time, it is okay. Start slowly and build up the physical activity over time. The more active you are, the greater the benefit. And don't be afraid to try something new. It's important that you enjoy the physical activity you take part in. Physical activity should not feel like a chore or something that you have to do. You should enjoy doing it. This goes over what is considered moderate intensity and what is considered vigorous intensity. So as I mentioned before, the American Cancer Society recommends 150 to 300 minutes of moderate intensity, so this category per week, or 150 minutes of vigorous intensity, so this column each week. So there are a lot of activities that are included, not just, running or jogging or weight training, but also mowing the lawn can count towards physical activity. If you are in a workplace that requires a lot of walking or lifting or heavy manual labor, all of that would count towards your physical activity. These are just some recipe links for the Mediterranean diet specifically, which is what we encourage patients who are in survivorship moving forward because the Mediterranean diet has been shown, great benefits in improving cancer risk and in addition to overall health. So you may have heard this saying before, but at Cleveland Clinic, we practice evidence-based care, meaning we will only provide you with sound recommendations backed by research. The remainder of this presentation will focus on the common nutrition fads and frequently asked questions related to nutrition after cancer treatment. So first up, we will discuss supplements. So, nutrition supplements includes vitamins, minerals, herbals, or protein supplements. And when we talk protein supplements, it's not like a booster and ensure type of protein supplement, but these are ones that have a lot of additives to it, a lot of extras. We want to make sure that you're contacting your doctor or dietitian if you are using any sort of dietary supplement. Because there is a cause for concern if you are taking certain vitamins, minerals, supplements, because there can be potential interactions with other medications or treatments. They're unnecessary expenses and they're not regulated by the FDA. So at this time, we do not recommend supplements for cancer prevention. However, if your doctor has recommended you take a supplement for a medical reason, please continue to do this. For example, sometimes a person will be prescribed a vitamin D or a multivitamin or things like that. If your doctor prescribes it and gives you the go ahead, please continue to take those supplements. Next, we're going to talk about sugar, which this is what we most commonly hear patients ask about is sugar and does sugar feed cancer? Or I've read that sugar is the worst thing that you can consume if you've had cancer. And I'm here to tell you that currently there's no evidence-based research that suggests or supports that sugar directly increases cancer recurrence. So all cells, including healthy ones, use glucose for energy, and glucose is just another fancy word for sugar. So even without sugar in the diet, your body will still use other sources, such as protein and fat, to make sugar or glucose in the body. Cutting out sugar will not starve cancer cells, but it is best overall to limit added sugars in your diet, just in regards to healthy eating overall. So decreasing added sugars is important, but I don't want you to, not eat certain food items because, sugar's the enemy or anything like that. So we want to limit added sugars. That doesn't necessarily mean that you need to avoid them at all costs because of any sort of cancer recurrence. So when it comes to added sugar is any type of sugar that has been added to food during processing or preparation. And the American Heart Association's recommendation is no more than 25 grams a day for women and no more than 36 grams a day for men. So when we look at the food label, the added sugars are going to be under the total sugar category. So this is what we really want to focus on when we're looking at added sugars. Sugar sweetened beverages and high calorie sweeteners are linked to a higher risk of weight gain and being classified as overweight or obese, which, as I mentioned before, can increase your risk of many different types of cancers. We often get questions asked about artificial sweeteners or non-nutritive sweeteners, which these are considered safe and they can be helpful in reducing the total added sugar intake. They are hundreds to 1,000 times sweeter than sugar, so you are less likely to consume a dangerous amount. However, that does not mean you can eat more of other foods or beverages because you're using these artificial sweeteners, but just know that they are safe when used in moderation. Another one that we commonly hear about is soy and, reducing or not consuming any soy products because of a fear that it will, cause cancer reoccurrence or worsen things. So soy is rich in protein and other nutrients. It contains a substance called isoflavones, which is a polyphenolic compound which contains antioxidants. Um, the American Institute for Cancer Research reports consistent findings from population studies that indicate no increased risk for breast cancer survivors who consume soy foods when soy is eaten in moderation. And the moderate intake of soy is up to 3 servings a day. So that is what's considered safe. However, more research is needed. Now, most Americans do not eat large amounts of soy, so that makes it challenging for the United States to have observational studies to compare how the highest versus lowest intake links to cancer risk. Most of these population studies involving soy come from Asia, where soy is a dietary staple. So studies actually now point to soy possibly protecting against some cancers, but more research is needed as evidence is limited. So overall takeaway is that moderate intake of soy is okay, up to 3 servings a day, and more research is needed. So the key takeaways of this presentation are making sure that you're keeping active and finding physical activity that you enjoy doing and that you can consistently keep up. We want to obtain and maintain a healthy weight. We want to eat a balanced and colorful plate, and we want to try to focus on a Mediterranean diet style of eating. We want to prioritize our hydration and decreasing our consumption of sugar sweetened beverages. And we also want to minimize or avoid alcohol consumption. If you are interested in working one-on-one with a registered dietitian at Taussig Cancer Center, you may call our scheduling at 216-444-6833 and tell the operators that you are interested in scheduling a nutrition appointment. You must be a Cleveland Clinic patient seen by one of our Cleveland Clinic oncologists in order to be seen. And our dietitian visits are free up to 1 year after your treatment stops. And they're also free while you're being seen by one of our oncologists during the course of treatment. These are my references. Any questions?
I think at this point, I'll go ahead and jump in and we're going to stop the recording, and that way any dialogue that takes place isn't part of the slideshow.
Perfect.